Hi, I'm Dr. Carrie Bevavino from Roaring Fork Equine Medical Center, and today I'd like to help you better understand lab work in your horse. I report to you from our very own in-house lab here at Roaring Fork Equine Medical Center. So to begin, why is lab work important in your horse? So lab work can be important to help to diagnose a variety of conditions or diseases that might require changes in management, exercise, or even treatment in some cases. And what we know is that sometimes blood work can recognize an abnormality before you even see clinical signs of it. So lab work can be very helpful in both protecting your horse and other horses in some cases as well. So what health conditions could lab work help to diagnose? Lab work can be very helpful at diagnosing disease of multiple systems. So whether that's the kidneys, the liver, the neurologic system, the endocrine system, looking for signs of infection, looking for signs of blood loss. There's a lot of opportunity for blood work to help guide you in recognizing that disease is present, monitoring treatment, and making sure your horse is healthy and stays healthy. So what's a Coggins test? So a Coggins test is a test that is usually run annually on your horse. It requires a blood draw, and what you guys probably also know is sometimes we always take pictures of your horse, and then you get back a nice form that you have to have with you, usually when you go to sales, shows, changing barns, etc. You'll notice that we usually always put it in one of these tubes that has what we call the tiger top on it. What the Coggins test is Coggins is actually named after the man who invented the test. And what the test is for is to evaluate if your horse is infected with equine infectious anemia, EIA, which is a virus that's spread by flies. Once your horse becomes infected with it, they can get really sick. Not every horse does, but the thing that really stinks is once your horse is infected for the rest of its life, which means not only does it pose a risk for your horse to kind of continually experience illness, but that also means your horse could potentially give it to another horse and make another horse sick. So if we ever do find a horse that's positive, we usually have to report it to government officials, and government officials have to become involved in order to ensure that the horse is appropriately quarantined away from any other horses in which it might be posing a risk to. So a really bad disease. Thankfully, it's relatively uncommon, but we do still see it pop up in various states across the U.S. So the Coggins test is important, and like I said, most places that you're going to travel to or have your horse boarded at will require an annual Coggins test. So is DNA testing good for your horse? So DNA testing can be very helpful to recognize a variety of genetic conditions we do see in horses. We don't often use it like people use in dogs to determine, breed, etc. But there definitely are certain breeds like the American Quarter Horse that do have genetic diseases that we test for to determine the risk to themselves as well as the risk to their offspring if they're going to be used as breeding animals. So like I said, DNA testing can be very helpful when determining if your horse is at risk or putting potential offspring at risk. So how do you take blood from the horse? So it's what I consider really non-invasive, as long as your horse doesn't mind needles. We usually use a syringe about this size with a needle like that. I'm going to try not to stab myself, so put it back on there. And we use the jugular vein most commonly. So that's the vein that runs down kind of the lower part of the horse's neck. And we usually take anywhere from 5 to 20 mils of blood depending on what we're going to be testing for. And then you'll notice we usually put it in a couple different tubes. So the tubes, we have the purple top tube here, which is different than the green top tube. And again, the tiger top tube that we use for the Coggins. So these tubes are different in the anticoagulant that's in them, and then kind of what we can get from them. And also depending on what test we're running and on what machine, it requires a particular type of anticoagulant or blood sample. So like you'll always see us kind of pull out a variety of tubes. We do this because it helps us acquire a different type of sample to test for different things in it. So that's why we usually end up collecting quite a bit of blood, or it seems like quite a bit of blood for a horse. It's hardly anything, so no big deal there. So how often should you do lab work on your horse? So it really all depends on your horse. If your horse is healthy and performing well, is in good condition, is eating well, sometimes we really don't need to do it that frequently, if at all. If your horse has been diagnosed with a particular condition, whatever that condition is probably going to dictate how frequently your horse is monitored. So if for some reason your horse is very severely affected by kidney disease, we might be monitoring that like once a week, versus other things like what we call equine Cushing's, or better known as pars pituitary intermedia dysfunction. Mouthful, we call it PPID, which is an endocrine disease we see in older horses. Sometimes those horses will get tested every 3 to 6 months, and sometimes just once a year. So it very much depends on your horse, how your horse is doing, and whatever disease they've been potentially diagnosed with. Like I said, if your horse is healthy and doing really good and you're not noticing anything wrong with your horse, we might not really need to repeat blood work very frequently, unless something comes up or something changes. So how long does it take for your blood work results to come back? All depends on what we're testing for. So like I said, we're here in the Roaring Fork Equine Medical Center lab, and we have a lot of our own blood work here. So this machine here is what we call our CBC machine, which stands for Complete Blood Count. So this machine is going to measure white blood cells and red blood cells in the system. This test right here takes about 5 minutes to run. Once we put that request in, run the blood, and it takes 5 minutes before we get the results back. The other machine we have here, which is our chemistry machine, this is the machine that we use to run things to evaluate liver disease or kidney disease, electrolytes or proteins, etc. That test takes about 20 minutes to run, so pretty quick. We also have this nice little handheld unit here. This unit here takes about 5 minutes to run as well. This one we usually use for what we call blood gases. So this I use in when running anesthesia a lot, so it gives us kind of quick results on how well your horse is oxygenating its blood, checking blood gas levels, stuff like that. So we have the capability to run a lot of these tests in-house. With that being said, there's still a lot of tests that we're going to send out to outside labs to run. So that all depends on the lab and what we're testing for. So for example, your Coggins test, when we send that out, that usually, once it gets to the lab, it usually takes a day. So you can get these results back in usually 2 to 3 days, so pretty quick turnaround time. Versus other tests that we might send out, EPM, or equine protozoa myelitis, is a common one we'll send out blood for. One of these tubes, that can take up to 4 to 5 days, business days, to get the results back. So it very much depends on what we're testing for, but a lot of these things that we end up doing in the field, we'll get the results the same day and we can report them to you pretty quickly. So pretty quick turnaround time for some stuff, have to be a little bit more patient for the other things. So lastly, what do you do if your horse has an abnormality on blood work? Again, it very much depends on what your horse has. So there are some things we might find on blood work that we say, no big deal, we'll just monitor, versus other problems that might help guide us in treating your horse for something, or monitoring in certain conditions, or even pursuing another test to further determine what's going on with your horse. So it very much depends on what that abnormality is. I say don't panic, because there's always more information that we can gain about the problem, whatever your horse is, and possibilities of treatment as well. So key is don't panic. So with that, I hope you guys have better understood lab work in your horse. If you have any questions, never be afraid to reach out to us at Roaring Fork Equine Medical Center. You can contact us at 970-987-4757. Thank you guys.